Now to an in-depth look at Alzheimer's disease and its impact on patients and caregivers. The World Health Organization says every year nearly 10 million new cases of dementia, including Alzheimer's disease, are diagnosed by doctors around the world. That's one new case every 3.2 seconds.
According to the Cleveland Clinic, dementia is an umbrella term describing mental decline that's severe enough to interfere with daily living. And the Alzheimer's Association says the role of caring for someone with dementia often falls on a family member.
And now we can only imagine the emotional and even physical challenges of caring for a loved one with dementia. In fact, a June 2020 report by AARP reveals only 10% of caregivers describe their own health as excellent and say these challenges can often lead to feelings of burnout. We took an in-depth look at the caregiver crisis and the need for more resources and support. Noelle Esquire says she saw the changes in her dad.
He was in his 80s, and so you kind of just associate that with like normal aging when people have, some memory challenges.
Noelle moved back to her parents' home in North Carolina to help when he started showing signs of dementia, signs that included confusion doing everyday tasks and trouble following conversation and finding the right words.
It's exhausting physically and emotionally.
Noelle is like the 11 million other Americans the Alzheimer's Association says provides unpaid care for people with Alzheimer's and other forms of dementia. About 35% of those caregivers are age 65 or older, and approximately 2/3 are women like Noelle.
That added stress ended up not being sustainable long term.
A January 2022 report by the National Institutes of Health echoes Noelle's feelings, finding depression occurs in at least 1 in 3 caregivers. We did some further digging and found a CDC report published in 2019 says family members who care for loved ones with dementia are at greater risk for anxiety, depression, and poor quality of life than caregivers of people with other medical conditions. And the Alzheimer's advocate we spoke to says another issue caregivers face is finding medical care for their loved ones.
In a good world, a 6-month wait list for a neurologist or neuropsychologist, but that can typically be 9 to 12 months.
Sarah Lovegreen is the vice president of programs with the Alzheimer's Association. She says staffing shortages and specialist care across the country has been so bad, it's led to delays in care for some patients. A report released in 2017 by the Alzheimer's Association identified 20 states as potential dementia neurology deserts, meaning they're projected to have less than 10 neurologists per 10,000 people with dementia by 2025. The advocates we spoke to say they're now working to arm primary care physicians with the tools they need to manage an increased caseload of patients, as well as guidance for caregivers.
But there were times when I didn't think I would make it, and this group pulled me through.
The Alzheimer's Association says support groups can also provide caregivers with education to help those who may be feeling helpless.
This is family.
Mary Margaret Fosmark works with an Alzheimer's support group in the Richmond, Virginia area. It's the same group she turned to while caring for her husband as he battled dementia. After his death, she began helping other caregivers.
You know you're not alone.
As for Noelle, her father passed away in April of 2023. She's grateful for the support she found from a group near her parents' home in North Carolina.
Really just left us feeling more empowered to take this on, and then also give me, and I think also my mom, a sense of community to know that we're not going through this alone.
Of course, we all want what's best for our loved ones, but we have to remember to take care of ourselves.
I never think about that because you always feel so terrible for people going through things like that. But, thinking about even my family, like the people taking care of the sick people, it's a lot mentally and physically on people, for sure.
We all need support.
We all need it, yes.
And if you or a loved one need additional support, the Alzheimer's Association offers peer-to-peer professionally led groups. You can find one by going to the Alzheimer's Association's website at act.alz.org.